People are doing Ozempic parties here in LA where they all do an Ozempic.
Literally, I was in the elevator. I'm like, "You're too skinny."
Yeah,
and I said to
know.
Shane, "Could you imagine being too skinny?"
So
I've never in my life been too skinny.
Never. I went to lunch with like a girlfriend, and she's like, "I'm not really eating anything. I'm so nauseous. I'm on Ozempic." I was like, "Oh, I'm nauseous too." I go, "I'm on Semaglutide," and she goes, "That's Ozempic."
So that's what Hollywood talks about. Diabetes drugs are in hot demand over the dramatic weight loss effects. You saw celebrities doing it. Latest craze in Hollywood, but it's spreading beyond Hollywood. Among the most popular, Mounjaro, Ozempic, and Wegovy. But the results appear almost too good to be true. Are they? Is there a downside? Let's debate it out. Co-founder and chief medical officer at Levels, Dr. Casey Means is here, and a weight loss specialist, Dr. Sue Decotiis is here. Welcome to both of you. Dr. Decotiis, is there a downside to these weight loss drugs that were originally meant for something else, so-called off-label?
Well, many patients have been prescribed these medications improperly. So the biggest thing is a patient needs to be monitored very carefully. So if they're getting care through an app or something like that, it doesn't work. My patients, we start them off with a body composition scale. I want to know what is their body fat composition. When body fat is high, I know they're insulin resistant and they probably need the drug. So we monitor them for side effects. We make sure that they get incredible nutritional support. And also hydration, that's really key. We see them frequently, we speak to them every week, we weigh them as the weight is coming down, and I've been able to taper a lot of my patients off these drugs successfully by monitoring the body composition.
So once you get them down, you take them off?
Yes, if I can.
Will they maintain it?
Probably not if I'm monitoring the body fat composition. Okay, so this is the big difference. Most physicians are just putting patients on a scale and looking at their BMI, which does not give you an accurate view of what's really going on. So some patients have gained a lot of the weight back,
Gotcha.
And they've been nutritionally compromised because they haven't gotten the best care.
Gotcha. So Dr. Means, what is your sense on this?
Brian, 73% of Americans are now overweight or obese. And the fact is, it's not because of an Ozempic deficiency. 100 years ago, 10% of Americans were overweight and virtually 0% were obese. And the reason Americans are eating themselves to death these days is because nearly 70% of our calories are coming from ultra-processed, factory-made frankenfoods that are designed to make us insatiable. And so I think there's three key side effects about Ozempic that people really need to internalize as we talk about this craze. The first is the side effects. So just glance at the packaging insert of the drug, and you'll see things like thyroid cancer, pancreatitis, kidney failure, hypoglycemia, nausea, vomiting, diarrhea, allergic reactions. These are very serious side effects, and these medications are being recommended in kids as young as 12. The second issue is declines in muscle mass. We think that this is just melting away fat, but research has actually shown that this is decreasing our lean muscle mass, which is key for health and longevity. And it's actually statistically significantly lowering muscle mass. And the third large issue is what we were just alluding to, which is weight regain. Large meta-analyses have shown that, yes, people can dramatically lose weight very quickly on these medications, but the majority of people gain back the majority of the weight and reverse any health benefits that came from the medication.
And it's still
so this
so
is
new
not
too.
really getting to the root cause.
Dr. Decotiis, they're not all the same. Eli Lilly says, I think with Mounjaro, it could be the most successful pharmaceutical drug ever if it's as effective as the early results are.
I think it will be. I think the key problem when people are obese and are diabetics is insulin resistance. This is a syndrome that really affects every single organ system of the body. And when we treat insulin resistance, not only do people lose weight, but they have better mental functioning, cortisol levels go down, and their appetite changes long term. But again, the key here is monitoring the patient, Brian.
Gotcha.
If patients are not being followed with body composition and they're not getting careful care, they can regain this weight. The side effects that Dr. Means mentioned, the thyroid problems and all that, that's very rare. There's a rare endocrine syndrome called multiple endocrine adenomatosis that very, very few people have. I think I saw one case in medical
Unfortunately,
school.
we're up against it. Got it. Just real quick, Dr. Means, do you find it rare?
I think these side effects are extremely serious, and we cannot gloss over them. When we're having major GI dysfunction with 70% of patients discontinuing the medication because of side effects, we can't just gloss over it. And for $10,000 a year for this medication, we could be shipping healthy organic food to every patient in the country and actually reversing the insulin resistance that causes obesity.
Food is not going to treat this epidemic.
We're going to bring this up again and again, and we'll have you back, because I think you just educated a lot of people on both sides. There's hope and there's worry and there's concern, but we'll see what's straight ahead. Thanks so much, doctors. Appreciate it.